Hello, this is Dr. Getty Chimeka Anyanwoke. I am an infectious disease physician and I practice in Louisiana, USA. Today, we are going to be continuing on our series of discussions on sexually transmitted diseases, STDs. Our fifth topic on the series is on Herpes Simplex virus. Herpes simplex virus is a sexually transmitted disease which is very common among sexually active individuals. Most times, there may be no signs or symptoms. Now, even though there may not be any signs or symptoms, the affected persons can still spread the disease to their sexual partners. Now, let's talk about genital herpes. Genital herpes is a sexually transmitted viral infection of the genital area. It was previously associated with only herpes simplex virus type 2, HSV2. However, given the sexual practices of these days, especially oral sex, etc., it can also be caused by herpes simplex virus type 1, HSV1. This brings us to oral herpes, also known as herpes labialis or cold sores or fever blisters. It is a very common condition. It is a viral infection of the mouth area, mostly transmitted by mucosal contact with an infected person's mouth secretions and not necessarily sexual contact. It is associated with herpes simplex virus type 1, HSV1. However, given the sexual practices of these days, oral sex and others, it can also cause sexually transmitted infection even in the genital area. How many people get it in the USA? Oral and genital herpes are very common because of the easy way it is transmitted. It can be transmitted via oral route, vagina, or anal sex. Also, mucosal contact. An estimated 90% of the adult population in the United States will get oral herpes, HSV1, before the age of 50. This figure is from the National Institutes of Health, NIH. In the United States, it is estimated that about 1 in 6 people between the ages of 14 to 49 have genital herpes. The Centers for Disease Control and Prevention, CDC, puts the figure between 40 to 50 million people already infected. Also, there is an estimated 1 million new infections each year. So, let's talk about the symptoms. HSV viruses are latent. Most people have no signs or symptoms. For signs and symptoms of herpes type 1, this typically causes cold sores and fever blisters on the mouth, although in some cases it can cause keratitis, which is an infection in the eye. It can also cause infection in other mucosal areas. Let's talk about herpes type 2. Typically, this causes genital sores or blisters, but both viruses can cause sores in either area. A herpes outbreak can start as red bumps and then turn into painful blisters or sores. During the first outbreak, it can also lead to flu-like symptoms like fever, headaches, and swollen glands. So how do we spread herpes? It is spread through vaginal, oral, or anal sex. It can also be passed through skin-to-skin sexual contact, kissing, and rarely from mother to child during childbirth. Treatment of herpes. There is no cure for herpes. The virus stays in the body and may cause recurrent outbreaks. Medications can help treat symptoms, reduce the frequency of outbreaks, and reduce the likelihood of spreading it to sex partners. What are the possible consequences if left untreated? Herpes simplex virus increases the risk for infection of other STDs, including HIV. Some people with herpes may get recurrent sores. Passing herpes from mother to newborn is rare, but an infant with herpes can become very ill. For further information, please check out stdassessment.com. Again, my name is Dr. Getty Chimeka Anyanwoke. I am an infectious disease physician and I practice in Louisiana, USA.